Hello and welcome to this tutorial. I am going to teach you how to arc, and you are going to become an expert of your own emotional patterns. I'm Dr. Samantha DeCaro. I'm a clinical psychologist, and I'm the director of clinical outreach and education at the Renfrew Center. The ARC is a tool that we use in Renfrew's unified treatment model. It's a tool to help us get really clear about our own emotional patterns, about our triggers, help us understand why we do the things we do, and whether or not we want to experiment with different responses to get different outcomes. So this is a tool you can use. You can use it multiple times a day. You could bring it to therapy sessions. You can do it in a therapy session. It's a great tool to use to help you really get clear on your emotional patterns and your responses, and will also help you design future exposures if you want to work on emotional tolerance. So let's jump on in. In treatment at Renfrew, there is a gradual set of treatment steps. And so we will be today focusing on number 3, which is practicing awareness and acceptance of the natural unfolding of an emotional experience. However, before you introduce the ARC, it is important to make sure that you do understand the first 2 steps. So number 1, you do want to make sure that you have motivation to work on these things, because it is hard work tuning into our emotional experiences. It is hard work consistently doing ARCs. They take time, they take effort. We might not always be motivated, so it's very important to get clear about why you want to do this work, how it aligns with your values, because it can be difficult at times. The second step is, before you get started with the ARC, you want to make sure that you have a very complex understanding of how emotions function and how avoidance actually strengthens emotions, and avoidance actually ends up backfiring. So it's important to understand that, so you have some incentive to do this work. Because if you are someone who is in a pattern of avoiding, you want to really understand how that avoidance might be interfering with your values, your goals, and ultimately with your emotional tolerance. So you do want to get clear on those 2 steps. Number 3 is when we start using the ARC, and you start using this tool to help you understand your patterns. And after you've mastered the ARC is when you deliberately make a plan to change your patterns and experiment with different behaviors to hopefully get a different outcome and build that emotional tolerance. Finally, in treatment, what we do is we develop a fear hierarchy where you actually plan emotional exposures so that you can build up your tolerance to really distressing emotions, so that you know that you have the confidence to face any emotion, no matter how intense, and you know that you can handle it. So today we'll be focusing on number 3, which is practicing the awareness and the acceptance of the natural unfolding of an emotional experience. And I'll go into a lot of detail about that, but the ARC is going to be our tool of how we do this, because the ARC is going to help us understand what are our immediate triggers, what are even the earlier triggers that maybe impact the way we're experiencing a situation or the way we're interpreting it. We'll take a really close look at our emotional response, which includes our thoughts, our physical sensations, and our urges and behaviors, and then examine the outcomes of how we respond, the short-term outcomes and the long-term outcomes, so that we can make decisions about whether or not we want to experiment with different patterns and different ways of responding. So what is mindfulness? Mindfulness is really at the root of eating disorder treatment. It is the foundation of everything. And I want to make sure that in this presentation, we all have the same definition and we're all working on the same page when it comes to mindfulness, because I do think there are many different interpretations of what mindfulness actually means. In this presentation, mindfulness means paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. The non-judgmental part is probably one of the most important parts of mindfulness. We do not want to judge our experiences or our responses. They aren't good or bad, they're neutral. And so we are only looking at the outcomes and whether or not we want to experiment with different ways of existing in the world and in our relationships. We can really start to get clear on why we do the things we do, maybe why we're stuck in a really reinforcing pattern, and we can make a decision about whether or not we want to change that. So mindfulness is about taking a look at our own emotional patterns without any judgment, and then allowing ourselves to decide whether or not those patterns match up with the life that we want to live and match up with our recovery. So mindfulness is not relaxation, guided imagery, clearing the mind, deep breathing, distraction, or even thinking positive thoughts. I think there are many definitions of mindfulness floating around, and many people sometimes think that forcing yourself to relax or making an effort to distract yourself and remove yourself from your present emotional experience is mindfulness, and it's actually not. Mindfulness is being able to anchor into the present moment without judgment, without changing your emotional experience. So relaxation, although that definitely has its benefits and can be a valuable coping skill, it's not mindfulness. Because if we're trying to induce a state of relaxation, we're actually removing ourselves maybe from the emotional experience that's happening in the present moment. So with mindfulness, we want to be able to identify exactly what we're feeling and allow ourselves to lean into it, allowing it to rise and fall on its own. Mindfulness is not clearing the mind or changing your thoughts in some way. That's actually a separate skill. So we want to be sure that when we're talking about mindfulness, we are actually talking about observing our thoughts without judgment, just observing them and allowing them to happen, not trying to push them away, not trying to reappraise them or change them in some way, but just noticing them so that we can start to notice our patterns. Maybe we're telling ourselves the same stories over and over again. Maybe they're coming from core beliefs, and many of our thoughts reflect that core belief. So we need to do this in a non-judgmental way in order for us to learn about ourselves. Deep breathing can be also a very valuable coping skill. And again, it's not mindfulness because deep breathing can actually take us out of our emotional experience. With doing the arc, with mindful emotional awareness and with emotional exposures, we actually want to feel our emotion even at its intensity so that we can learn over time that it's both temporary and tolerable. Distraction, although sometimes can be helpful temporarily, distraction is not mindfulness because again, it takes us out of our emotional experience. And oftentimes with distraction or other avoidance strategies, the emotion that we're trying to escape actually strengthens. And so we teach ourselves over and over again that we cannot handle this emotion, and the emotion feels like it's not possible to tolerate. So with distraction, we teach ourselves over and over again that we need to escape from an emotion. When mindfulness actually will invite you to sit with the emotion and allow it to happen. So what is mindfulness? Well, I believe there's two parts of mindfulness, and this is what we teach in Renfre's Unified Treatment Model. There's our inner world, everything happening inside that can't always be seen. And then our outer world, which is very similar to using grounding techniques, for example. So mindfulness is both, and it's not one or the other. It's a skill, and it invites you to mindfully observe without judgment both your inner world and your outer world. So when we talk about the inner world, we're talking about our emotional components, and there's three of them. So to mindfully tune into your inner world, it really is about observing your thoughts, your physical sensations, and your behaviors and your urges to behave. So we call this the 3-component model or the 3-point check. And this is really a skill to be able to check in with yourself when you're feeling an emotion, or check in with yourself throughout the day and ask yourself, what am I experiencing right now? Can I describe it? Can I write down my thoughts as if they're quotes? Can I tune into my body with a full body scan and try to pinpoint exactly where I feel this emotion in my body? Can I tune into the urges that I have to act? Maybe I have the urge to distract myself. Maybe I have the urge to leave the situation. And can I also pay attention to my behaviors? What's happening? Am I fidgeting? Am I looking at the ground? Is my leg shaking? What am I experiencing behaviorally? So we want to tune in to all of those things. Physical sensations can range from a rapid heart rate, sweaty palms, anything that you feel, tense muscles, anything that you can feel really in the body. So our outer world is what we will also observe mindfully, which includes tuning into our senses, what we smell or taste, what we see and hear and touch in the present moment. Can we feel the ground below us and the chair? Can we smell something in the air or hear something, maybe something subtle outside? So being able to tune into our environment, but also at the same time, tuning into our inner world, into those three components. That is really what mindfulness is about. Once we start to do this, we can begin to document it. And then we can really expand our awareness to understand maybe what triggers on these emotional responses, and then what outcome do we get based on how we choose to respond in the moment. So let's talk about the natural course of an emotion without interruption. So this means without distracting yourself. This means without doing something to try and escape from the emotion. So if we allow ourselves to feel an emotion and lean into it fully, what we will see is that the emotion will rise and fall on its own. We don't even have to do anything. If we just give it time, we will see that emotion, all emotions, even the distressing ones, and even the ones we don't mind so much, like happiness, those emotions will rise and fall on their own. All emotions are temporary. There aren't any emotions that will last forever, although sometimes we tell ourselves the story that our emotions are never going to go away. The reality is, if we just allow them to rise and fall, we can learn over time. We can tolerate our emotions, even when they're at their peak. So the problem with avoidance, and avoidance comes in many different forms, and I talked about a few, but the problem with avoidance is that we get stuck in a loop where we really rely on avoidance to tolerate our emotions. So to give you an example, when we feel an emotion coming on, we feel maybe sensations in our body start to activate, our heart maybe starts to race, our stomach flips, we feel tense. Maybe those thoughts start to rise about whether or not we can handle this emotion. Maybe thoughts pop up about how difficult this is to experience. And we get to a point where that stop sign is, where we tell ourselves a story about the emotion that we're experiencing. And that story might look like, I can't handle this. I have to do something to escape this emotion. So what we end up doing is we get stuck because the avoidance will temporarily reduce our emotion slightly. However, it never gives us the chance to build full emotional tolerance because we never get a chance to actually ride the wave of the emotional experience. So avoidance, I'll go into detail about the different types, but some really common avoidance strategies are sort of checking out and watching TV, or scrolling on your phone, or playing a game to distract yourself. This can really give us temporary relief. However, over time, we teach ourselves that we can't handle this emotion, and we never even get the experience of learning that we can. So we do get stuck in this loop. What mindfulness teaches us, when we're able to anchor into the present moment and allow ourselves to fully feel an emotion, allow it to rise and fall, when it's at its peak, we learn that emotions are temporary. We learn that emotions are not dangerous, even when they're a 10 out of 10. Yes, they feel very uncomfortable. However, when we can ride the wave of emotional experience, over time we learn that we can survive that experience without turning to any kind of avoidance strategy. We also learn that emotions are tolerable and that they will naturally fall without doing anything, as long as we just give it some time. So mindfulness teaches us these things. And so as we build up the confidence, we can begin to expose ourselves to more emotions and build up that tolerance to really any type of emotion that we might face. So avoidance strategies, what are they? These are strategies we use to avoid strong feelings or to prevent emotions from becoming more intense. So avoidance strategies can sometimes happen even before the emotion is triggered on. We learn what situations cause us to feel intense emotions, and we might learn to just avoid those situations completely, whether it's going out to eat with friends, going to a party, whatever it may be. We learn what are the situations that give us intense emotions, and we learn to avoid them. But avoidance strategies can also happen in the middle of having an emotional experience where it's beginning to rise, and you tell yourself that story that you don't want to feel this, and then maybe you turn to an emotional avoidance strategy in an attempt to cope with it. However, the problem with avoidance strategies is that they only work temporarily, and they actually make the emotion feel more intense over time, and they don't really help you build the confidence that you can handle your emotions, even at their peak. So avoidance occurs most often with distressing emotions, but avoidance can happen just about any emotion if it's intense enough, even like happiness or pride. So it's very important with the arc, you can start to learn what are the emotions that you are avoiding? What are the emotions that you'd like to work on and you'd like to build tolerance to? So the arc will help you reveal those emotions. So the three types of avoidance strategies. The first one I want to talk about are subtle behavioral avoidance strategies. So these are things that we do. Sometimes they look very obvious, and sometimes they're a little more subtle. So it's important to really pay attention to the kinds of behavioral strategies you're using. What are your go-to strategies when you're feeling an intense emotion? So maybe it could be something as subtle as looking at the floor when someone's talking to you, or standing near an exit when you're in a group full of people, maybe putting your hands in your pocket or fidgeting. These are all behavioral avoidance strategies that do help us temporarily in these situations, but we never get a chance to fully lean into whatever emotion we're feeling in the moment. So think for a second, what are some of your behavioral strategies when you find yourself in an experience that's giving you an intense emotion? What are some of the things you notice that you do? Do you take out your phone and scroll on your phone? Is there somewhere you stand in the room? So we all have them, we all do them. It's just important for you to get clear on what your behavioral strategies are. The second type of avoidance strategy I want to talk about is the strategy of cognitive avoidance. So this is a little harder to detect because we can't see it. It's happening up here. This is something that we do to not think about whatever is causing our emotion. So it's anything that you do to put your mind in a different space. So it could be reading a book, it could be watching TV, it could be repeating some phrase in your head or singing a song in your head. Maybe it's counting in your head, whatever is happening up here in an attempt to get yourself out of the present moment. It's okay if you do these things. What is important is that you don't judge it and you just notice it and get really clear about what are your cognitive strategies that you use when you're feeling intense emotions. These are the ones that you'll want to write down when you do the arc, which I'll explain later. So when you are aware of your cognitive avoidance strategies, what you can do is when you notice them, you can gently bring yourself back to the present moment and try to lean into what you're feeling. So whenever you notice an avoidance strategy, what's important is that you just notice it without judging it and bring yourself right back to whatever emotion you're trying to avoid. And the final avoidance strategy is called a safety signal. Safety signals are actually objects that we maybe carry with us to help us feel better about being anxious or being afraid. So some examples could be carrying a water bottle with you everywhere, or a blanket, or a good luck charm. A person can even be a safety signal. If maybe you refuse to go somewhere unless a certain safe person is with you. These are all signals you send to yourself that you can't handle this emotion and this situation without this thing, without this person. So these items or this person doesn't actually allow you to fully lean into your emotional experience. So try to be aware of what your safety signals are, because when you do emotional exposure work, these are the very things you'll want to try to leave behind so that you can start to build up tolerance to your emotions. So before you start to do the arc, the first step is to learn the 3 components of an emotional experience. And we learned about this earlier when I talked about mindfulness. So I talked about our inner world and our outer world. So let's focus right now on our inner world, because this is what you're going to be putting down on your arc. This is the bulk of the arc, and it's right in the middle. So you really need to practice this first before you start using the arc. You can just take a blank sheet of paper and draw 3 big circles and use that, and use it for homework, and pull it out at the end of the day or throughout the day when you want to document your emotional experiences. It's best to try to document these experiences as quickly as you can so they're fresh in your mind. So I do recommend that folks try to complete 3 component models throughout the day. So the first thing that we want to try to tune into are the physical sensations. So whatever this emotional experience is, you don't even have to label it at first. You just want to try to tune in to one of these bubbles. So let's start with the physical sensations. And some of you might notice that you're really good at tuning into one bubble. The work is about trying to tune into the bubbles that are not so obvious to you. So for some of you, the physical sensations might be really easy. You might very easily notice that you feel nauseous, or you feel really tense or shaky. And so those physical sensations might come very naturally to you and might be very easy to write down. You will know what component is easiest for you because that bubble will probably be filled up with the most words. Next, we want to really try to focus on the thoughts. What are the thoughts that you're noticing, and put them in quotes and notice them without judgment. Try to write down as many as you can and try to tune into what are the stories that you're telling yourself? What are the interpretations that you're automatically making about the situation? Probably what you'll discover over time is that you're actually telling yourself the same sort of stories and interpreting things in a very similar way with each situation. And that's probably because you have a core belief at the root of those thoughts. So your interpretations oftentimes are coming from those core beliefs that may or may not be true. Finally, we want to tune into our behaviors and our urges. And you can ask yourself the question, what do I have the urge to do right now? And what am I actually doing? And so again, those behavioral things might be a little harder to notice because they can be really subtle, but with practice, it gets a lot easier. So here's where you might notice some behavioral avoidance strategies. In the thoughts bubble, that's where you might notice some cognitive avoidance strategies pop up. You might find these in both bubbles. So here in the 3 component model is where it will really reveal to you the different avoidance strategies that you might be using. Here is our arc. And as you can see, you can make your own arc out of a blank sheet of paper. There are forms certainly that have this written out for you. However, really all you need is a blank piece of paper with 3 separate rows, and you can make your own arc. I recommend that people do as many arcs as they can a day. The more arcs you do, the better you will get to know yourself and get to understand your own patterns. And if you bring your arc in to a therapist, they can really help you add on to it or clarify things, or maybe help you see some patterns and help you understand maybe why you might be interpreting things in a certain way. So the ARC stands for antecedents, which is just a fancy word for triggers. The R is for response, which is 3-component model that we've been talking about this whole time. So the 3-component model is really the bulk of what you're doing, and you need lots of practice with that middle row before you try and arc. Finally, the C stands for consequences. I like to sometimes use the word outcomes. We're really just looking at what happened next, what happened in the short term based off of how you responded, and then what happened in the long term. So this is how you break down an arc, and it really helps you understand not only what your triggers are, because over time you'll start to see a pattern of what your triggers are, but you'll start to learn how do you tend to interpret certain situations and how do you tend to respond? What are the avoidance strategies that maybe you use over and over again and get stuck in that cycle? And then what are the outcomes that happen based on how you respond? So as you can see, this form can really help you become a master, an expert of your own emotional patterns. Here's a sample arc to show you what it might look like. So you want to put the date and the time because this can be really important too. You might notice that certain times of day, you're more prone to feeling certain feelings or interpreting things in a certain way. The immediate antecedent is what just happened to trigger on that emotion. So we're not judging it at all. We're just stating the facts, stating what happened to trigger this on. So it could be a phone call with someone, some interaction with someone, it could be a meal. It really could be anything at all, but we want to make sure we write it in neutral terms. So we don't want to say, oh, it was a horrible experience in the dining room. So that's a judgment. We just want to say, I was eating in the dining room. Earlier antecedents, there are many, many examples of what an earlier antecedent is, but this is something that maybe happened earlier in the day before, a week before, even way back in your history, or maybe even back through generations. All of these things can impact how we experience things in the present moment. So the earlier antecedents could be something as simple as, well, I didn't really sleep very well last night. Maybe you missed a dose of medication. Maybe earlier in the day, you had a very intense family session or a very intense interaction with someone. Maybe a memory came up for you. Maybe it's a time of year that's quite painful for you, and there's memories that are fresh in your mind. All of these things can impact how you experience the present moment. So writing down your antecedents can help you really get clear on what are the things that are impacting your response. There's an entire row for you to write your physical sensations. These might be, in this example, a pounding heart, feeling tense muscles, maybe you're feeling shaky, maybe there's nausea. So these are all examples of physical sensations that could also impact the way you respond in this situation. Here are some thoughts that this person had eating in the dining room. I can't eat yogurt. I haven't eaten dairy in months. This feeling will last forever. My heart is beating way too fast. So sometimes we have thoughts about our physical sensations that may or may not be true, that impact how we behave in that situation. So the behaviors that this person noticed, they noticed that they delayed eating. So they maybe were staring at their plate for a while. I would put that into if you were staring at your food or maybe staring at the floor, that's also a behavior. Crying is a behavior. Running out of the dining room is a behavior. And crossing your arms tightly is a behavior. I would also add in here urges. So it's important to also be aware of what your urges are in this moment. Maybe you had the urge to run out of the dining room, but you actually stayed put. Those are just as important as the behaviors that you write down. Finally, in the consequence section, let's look at the outcomes of what happened. So based off of the behaviors that you chose in that moment, what happened next? Oftentimes, especially when we have avoidance strategies at play, many times there is some short-term relief. So we always want to ask ourselves, what was the function of this behavior? Why am I choosing this behavior? Because it did something for me. Otherwise, I wouldn't have done it. So, for example, running out of the dining room, maybe this person noticed that they felt a little less anxious and maybe their nausea went away a little bit, maybe it just decreased when they ran out of the dining room. That's a very reinforcing pattern. So this arc can help this person understand, oh, that's why I run out of the dining room. Look at how it's reinforcing me, because when I run out of the dining room, I feel a little bit better. And when we feel a little bit better, even temporarily, that can increase the likelihood that we're going to choose that behavior again and again and again. The only problem is, in the long term, this person missed an opportunity to build tolerance to that anxiety. They missed an opportunity to build tolerance to a fear food like yogurt. So we need to pay attention in the long term, maybe how our avoidance strategies interfered with what we really do want to do eventually. In the long term, this person also still had to eat and was still scared of dairy at dinner. So again, another missed opportunity. Sometimes crying can actually decrease emotions temporarily as well. Arms crossed tightly, that might also have an outcome. I would encourage this person to really tap into what was the outcome of each behavior that they wrote down. After you complete an arc, it can be helpful to just take a look at those three components, the sensations, the thoughts, and the urges and the behaviors, and then try to label what feeling that might be. So based off of the sensations and the thoughts and the behaviors and urges we see here, it sounds a lot like this person might be experiencing fear and anxiety. Now we have a label for the emotion when we really take a close look at those three components. So arcing can be really helpful because it can help you become an expert on your own patterns. It helps you understand, why do you do what you do? It helps you understand what your triggers are, both your earlier antecedents, maybe antecedents triggers that happened long ago, and also the immediate antecedents that happened in the moment. So you also become an expert of your own triggers. You start to understand why you do what you do. You're probably getting either positively or negatively reinforced in some way. And this is a way that our brain gets trained to repeat those behaviors over and over again. So for example, when you run out of the dining room and you get that temporary relief, that is very negatively reinforcing and can make it more likely that you will run out of the dining room next time. Once you know that, then you can make a decision to make a different choice the next time you're at a meal. An arc can also help you reveal your behavioral avoidance strategies, your cognitive avoidance strategies, and your safety signals, so that when you plan emotional exposures with your therapist, then you can know which strategies you want to remove from those emotional exposures so that you can fully lean into your emotional experiences. We talked about triggers, and also we want to discover what are the emotional components that are very easy for you to notice, that are very easy for you to tolerate, and which ones are a little harder for you to experience, to label, to write down, and to tolerate. So you start to really understand what the work will need to look like in therapy moving forward. And finally, an arc helps us, it gives us all the information we need to build emotional exposures. So when you do a fear hierarchy with your therapist and you plan out emotional exposures, your arc is where you're going to extract all the information about what you want to, how you want to experiment and exist differently in the world. So an arc can be a great tool for that, and your therapist can really help pull out those components for you. This final slide is just about the Renfrew Center. And I want to encourage you to connect with us if you need support. We have a website with lots of good resources and information, www.renfrewcenter.com. You can call us at 1-800-RENFREW. We have sites nationwide, 19 total across the country. And the good news is that eating disorders, most insurance companies do fund the treatment of eating disorders. So if you need extra support, here's information. And I want to thank you for joining us.